Hello, viewers. A very pleasant good evening to you all, and we welcome you to our webinar conducted by Prakara Learning Private Limited. And I'm very happy to introduce today's speaker, Mrs. Neelima Vankar, and she has been associated with us for the past 3 years, and she has uh, done lot of videos with regard to medical and surgical nursing, and today she is going to discuss with you about the GNM syllabus, and then what is the scheme of examination and other things. And before she start, I just wanted to introduce her to you, and she is having a lot of experience in teaching GNM students, and she is graduated from St. Anne's College of Nursing from Warangal, and basically she is from Maharashtra, and she has 8 years of experience as nursing tutor as well as nurse educator. So she is going to deliver a beautiful presentation, and which will lead you or which will motivate you to do your or to choose your career in a beautiful way. And once again, I welcome you all. Have a nice day. And now the session is handed over to Mrs. Neelima.
Thank you, ma'am. Thank you for your introduction. So, good evening, students. So, as we are going to see about orientation of GNM, so I'm going to share few thoughts and how you are going to get oriented regarding GNM and how you will be getting interest in this. So, I welcome you all for this beautiful session. And as it is going to be your future, so I hope it will be easy for you to know what is the curriculum which is included in this, because without knowing, most of them will join and they will be just dropping in between why I have chosen this. So our topic is about dynamics of GNM, but before that you should know what is nursing. Nursing is an art. Art is nothing but it is having some skills. Now in order to draw a drawing, an artist needs some skills, but in order to do nursing, we need skills like care, communication, compassion, and human connections. So when we have all this as a part, the nursing is a beautiful profession. And nursing is also a science, which is a body of knowledge that is always changing with new discoveries and innovations. As you all know, when COVID has occurred, new vaccines and all this were discovered, and all new innovations are taking place. So before seeing this GNM curriculum, what is this GNM? GNM is a diploma program in general nursing and midwifery, which is of 3 years of duration. So in this 3 years, what you are going to have, what are the subjects you are going to have, where you have to focus, and how you are going to deal with the practicals, we'll see. So when we see as curriculum, so in curriculum, you all know this course duration is about 3 years, and weeks available per year. Like first year, it will be 52 weeks, and second year, third year. And vacation, you will be having vacation for 4 weeks. Then examination, like including preparatory holiday, preparation for exams, you will be having 2 weeks. Available weeks are around 46 weeks per year, and hours per week, that is 40 hours. And hours available per academic year, like first and second year, they are mostly 1840. Then hours available for third year. In third year, you will be having as part 1 and part 2. So in part 1, you will be having only 960 hours. As internship, that is part 2, you will be having 1248 hours. So in third year, same, you will be having 2 weeks of vacation as well as 2 weeks of examination. So when you see the total course duration, as it is 3 years, total you will be dealing with 5,888 hours. Now, when you see the course of first year or what are the subjects which will be dealt in the first year are, in this, you will be having 4 main papers, like exam paper. Paper 1, we are saying that is bioscience. In that, you will be having anatomy and physiology and microbiology. They will be divided into theory hours, like 120 hours total, which is 90 hours for anatomy and physiology, and for microbiology, it is 30 hours. In paper 2, you will be having behavioral science, that is psychology and sociology. Then paper 3, nursing foundations, like fundamentals of nursing and first aid. Paper 4, you'll be having main subject as community health nursing. In that, community health nursing 1, environmental hygiene, health education and communication skills, nutrition. So in this paper 4, all these 4 subjects are included. Whereas English, it is separate, and computer education is separate, where you will not be having the university exams for this, but you will be learning as a curriculum. And you will be having co-curricular activities, it is for 10 hours. So total first year will be around theory hours will be 625 hours. And in this, you'll be having practical. In the first year of your GNM, you'll be having only one practical, that is nursing foundations. So you can see in the practical hours, 200 lab hours and 680 clinical hours. So you will be going to hospital for the orientation, how you will be taking care of the patients and all. So when you see subjects in detail wise, anatomy and physiology, you can see here brain, lungs, heart, liver, all this. So you will be learning about what is the structure, what is the brain, or what is heart, what is the length, all this you will be learning in the anatomy. Whereas in physiology, you can see now various systems will be there. In various systems, how these systems are functioning. So mainly you will be functioning circulatory system, respiratory system, and gastrointestinal system, all how the body parts are functioning. And you can see musculoskeletal system and muscular system, skeletal system, we call it as. So in the first year, you will be having total anatomy and physiology 14 units. So total 14 units, like first one introduction, second introduction to detailed structure of body, blood, circulatory system, lymphatic system, respiratory system, digestive system, excretory system, endocrine, reproductive, nervous, sense organs, skeleton, and muscular system. So in anatomy and physiology, these all are 14 units, but it doesn't mean that you need to focus all the units. So in this, you need to focus mainly on these units like blood, circulatory, respiratory, excretory, endocrine. For example, in blood, they can ask you what are the blood groups. Then in circulatory system, they can ask what is the structure of heart, explain in detail. Then in respiratory system, they can ask you like what is lungs, can you draw the picture like that? They will be asking in detail for essay questions. And whereas in some sense organs and skeletal system, they'll be asking the multiple choice questions, fill in the blanks and choose the, match the following like this. So this is about anatomy and physiology. When you see about microbiology, microbiology is nothing but dealing with the microorganisms. So microorganisms can be like bacteria, virus, fungus. So bacteria, virus, fungus, so how these are causing the infection, or how we can protect from this infection, how we can destroy this, all this will be dealt in detail, like what are the microorganisms, what is infection, what is immunity, what is the control and destruction of microbes, and practical microbiology also will be there, where which type of microorganism is affecting the person can be dealt. So in this microbiology, you will be focusing mainly on the microorganisms, only what are the names and in detail about that particular microorganisms, but mostly you'll be focusing on the infection, immunity, and how to control and destruction of microbes. So in last, I will tell about the scheme of examination, how these two subjects are divided in one exam paper. So next subject is about psychology. So psychology, mainly it is about the structure of mind and how the human behavior is. So when we are feeded with good thoughts and good positive vibes, so definitely our psychology or how our behavior will be good. So in psychology, they will be dealing about the structure of mind, psychology of human behavior, what is learning, thinking, reasoning, observation, perception, and what is the personality, because there will be different personalities for a person. So what are the different personalities? And intelligence, what is the IQ of a person and how it is affecting the behavior of a person. So this is about the psychology. In this, you need to focus about the structure of mind, where they can ask you for multiple choice questions, and the psychology of human behavior. In this psychology, you need to focus mostly on the learning, thinking, reasoning, observation and perception, and intelligence. Then in behavioral science, second part is sociology. Sociology is nothing but it is the study of society, and what about how the social relationships will be, how our behavior will be in the groups, or how our action will be, then how we have to lead in the society. That also will be dealt in the first year as a sociology subject. So in that subject, you will be having individual. So introduction is common, then individual, then how we will be dealing with the family, how we will be dealing in the society, and how we have to deal in the community. So these are the units which are present in the sociology subjects. In this, you need to focus mainly in the introduction chapter, family and society. So in behavioral sciences, psychology and sociology both are included. Then in first year, for main subject or fundamentals of nursing is nothing but nursing foundations. Mainly in this subject, they will be dealing about how the temperature is checked for a patient, or how we will be taking care of the patient. What are the basic needs of the patient will be dealt in the nursing foundation. And this is the subject where you will be going to clinicals, and you will be having the orientation, how you will be dealing with the patients. You can have a physical touch, and you can have the good communicate, you can learn good communication skills. You can see here the introduction to nursing care of the patient, meeting the basic needs of the patient, how to assess the patient, and how to control the infection, what is the therapeutic nursing care, and introduction to clinical pharmacology. These are the units which will be dealing in the nursing foundations. Then mostly you will be focusing on the nursing care of the patient, like for unconscious patient, how you need to care, for disabled patient, how you need to care, what are the basic needs of the patient, how you need to meet, and how to break the chain of the infection, and how you give complete care to the patient. All these units carries more marks in the examination. In nursing foundation, we will be having first aid. So first aid is nothing but initial treatment which is given to the patients. So in case of emergencies, how you will be dealing with the patient, or which treatment can be given. So you will be dealing as a unit wise, what are the procedures, what are the techniques in the first aid, and in emergency, what is the first aid can be given. For example, for bleeding. So for bleeding, what is the first aid treatment you can give? And community emergencies and community resources, like you, in case if there is any bomb blast or any hazard happening, how you will be taking care, how first aid can be given. So that will be dealt in the first aid. So in nursing foundations, you'll be having two, like nursing foundations as well as first aid. Then community health nursing. So in first year and in the third year, you will be having both the community health nursing 1 and community health nursing 2. In first year, same, you will be going to the field, like they will be taking you to the rural and urban areas to know what are the cases present, or how you will be dealing with the patients, how you will be doing the survey. After doing survey, where are the PHCs, where are the UHCs, all you will be seeing. So in this, you can do introduction, community health nursing, like health assessment, where health assessment, in other subjects, you will be dealing with particular only that adult or child. But in coming to community health nurses, you can deal with elderly, you can deal with school people, preschoolers, infants, all small kids, all assessments can be learned here. And what are the epidemiology and epidemiological methods? What are the family health nursing care? And what are the family healthcare settings? How you will be referring the people from small units of hospital, like from clinics to PHCs to big hospitals, how you will be referring, how you will be maintaining the records and reports, like birth certificates, death certificates, and Anganwadis and all, you will be having the antenatal, postnatal, and about the babies, all the records, how it is maintained, you will be learning, and what are the minor ailments and how it has to be taken care. Then weightage units, mainly weightage units like community health nursing, then principles of epidemiology and epidemiological methods, how the family health nursing care, home visit, mainly they can ask what are the principles of home visit and how the records and reports are maintained. Then in the community itself, you will be having 4 subjects you have seen in the first slide. So in that, environmental hygiene. So we all know when the environment is healthy, then person can be protected from various infections. Air pollution, water pollution, all this. So how it has to be controlled or how we have to protect ourselves will be seen in this units. Like what are the environmental factors contributing to the health and what are the community organizations which are promoting to the environmental health. Then next, in this community health nursing, again you will be having health education and communication skills. Health education. Now, in order to know about what is happening in the community, now in like previously about tuberculosis. In tuberculosis, awareness has to be given. So health education is the subject where you will be dealt how the awareness can be given to the public, and communication skills. So we all know communication is the basic skill or basic key where we can reach out to the people. So in this, you will be having unit 1 as communication skills and unit 2 as health education, then counseling, where it is very much important even to the patients, how we need to counsel, and even for the people living in the society, or even when we are dealing with the other persons, and what are the methods and media which is used for health education. Then coming to last subject in the first year, that is nutrition. In nutrition, what food has to be taken by us, as well as to the patients will be saying that in case if they are anemic, they need to take iron rich diet. So like that, what food has to be taken, what foods has to be avoided will be dealt, and what are the daily requirements, which food keeps us healthy, all this will be dealt, like classification of food, normal dietary requirements, food preparation, how it has to be preserved, and what are the safety methods to handle the food, and what is the therapeutic diet which can be given, and what is the community nutrition, then how the preparation of diet can be done. You'll be having practical session for preparation of diet, that some based on the dietary requirement, how the food can be prepared. So practically you'll be showing. So in this, till now it is about first year. So in first year, we have dealt with the different subjects, and in till here, you will be having these are the main subject papers where you will be writing the exam. And English and computer will be there, where you will be dealing in the college as a curriculum. Just you will be learning about English classes and computers, so how to do Excel, Microsoft, and PPT presentations and all. That will be dealt in the college itself. It will not be as a part of exam. Now we'll see about course of instructions, which is for second year. In second year, you will be having main subjects like medical surgical nursing 1 and medical surgical nursing 2. Then paper 3, mental health nursing. Then paper 4, child health nursing. So in this medical surgical nursing 1, surgical nursing 2, for both, you will be going to clinicals. For mental health nursing also, you'll be going to clinicals. Then child health also, you'll be going to clinicals. You can see here in the theory hours. In the theory, it is about 120 hours for the medical surgical 1 and 120 for medical surgical 2. Whereas practical hours, it will be around 800 hours, where mostly you'll be going for the 20 weeks, where you'll be posted in different areas like ICUs, ortho ward, neuro ward, then respiratory ICUs, and neuro ICUs, all ICUs, where you will be getting more exposure about how to deal with the adult people. Then, whereas you will be dealing with the mental health nursing. Mental health nursing, where psychiatric people will be there, where they will be mentally ill, and you in theory part you will be learning only about 70 hours, but you'll be going for 8 weeks of practical hours, where you will be dealing how the patients are in the hospitals, and you'll be dealing how the patients getting recovered and all. Then paper 4 as child health nursing, where it is related to the pediatric people. So when we see the medical surgical nursing 1, So mainly you will be learning, you'll be going to operation theaters, you'll be going to ICUs, you'll be going to various wards. So you'll be learning about various instruments, various methods, how you will be taking care, how you will be doing the dressing, all these areas you'll be learning. So in this, you can see the nursing assessment, then what is the pathophysiological mechanism of disease, how the disease process is happening. Whereas in first year, you'll be just learning what is the normal functioning, what is happening in our body. Whereas in second year, you will be dealing what are the mechanisms of disease, how our immunity is affected, what are the abnormalities happening, and what are the medical treatments, what are the surgical treatments, how it can be done, all will be dealt in the second years. That's why you can see it is medical surgical nursing. And unit 5, you can see fluid and electrolyte balance and imbalance. What are the operation theater techniques? What is the management of patient undergoing surgery? So before surgery, during surgery, after surgery, how the patient has to be taken care, all will be dealt in this. And whereas all the systems like respiratory system, GI system, endocrine system, urinary system, neurological system, connective tissue or collagen disorders, all various systems, what are the disorders, how the main focus will be about the nursing management, how the nurse has to take care of the patients when they are affected with the particular organ issues. So you can see in the weightage units for the second year, mainly nursing assessment. Nursing assessment, health history and physical assessment, you need to be thorough with that. And what are the operation theater techniques? So what before, during and after surgeries, how in the operation theater, what are the scrub nurse will do, or what type of a nurse, how is she will be involved. All the techniques will be learned, and all the systems are important in this unit. Like if it is respiratory system, they can ask you in detail about define COPD, like chronic obstructive pulmonary disease, and you need to say write about the causes, and in detail you need to explain about the nursing management, what can be done for the patient when the patient is having chronic obstructive pulmonary disease, and what are the complications which can occur, and how you have to deal with. So each system in this area is important, and you need to deal. Whereas when you see nursing management of elderly, mainly elderly people, they will be having different issues like cognitive issues, learning issues, thinking issues. So how the elderly person has to be taken care by the nurses will be dealt in the medical surgical nursing 1. Whereas in medical surgical nursing 2, you can see oncology nursing. Oncology nursing, mainly it is dealt about the cancer patients. So for cancer patients, how you need to take care of cancer patients, how the treatment will be different, like they need to go for radiation, or they need to go for the chemo medications and all this will be dealt in the oncology nursing. Then nursing management of patients with the disorders of breast disorders, either in the men or either in the women. Then even in the men, there will be some breast disorders like gynecomastia, how it has to be dealt. Then integumentary system like skin disorders, ophthalmology, mainly it is about the eye disorders. Then unit 5 about ear, nose and throat disorders. And next one, cardiovascular, circulatory and hematological disorders. Then patients with communicable diseases, sexually transmitted diseases, musculoskeletal disorders and diseases. So all this system disorders will be dealt. And in this, how main focus of medical surgical nursing is how nursing management, or how you will be taking care of the patient. Then emergency management and emergency and disaster management, mainly when there is floods. So during floods or during any bomb blast, most of the patients will be affected. So as an emergency nurse or disaster nurse, how you will be taking care. So in this medical surgical nursing too, all these units are important. They can be asked for the bits as well as for the essay questions. In second year, next subject is about mental health nursing. So mental health, you all know, when we are able to adjust to the environment and to all the people, that means our mental health is good. But there are some people where they are affected mentally. So how their feelings are. So when it is supposed to be laughed, they will be having hallucinations or some other. So in mental health, you will be dealing with the history of psychiatry, mental health assessment, how you will be assessing the mental health patient, and how the therapeutic nurse-patient relationship, what are the mental disorders, and what are the special therapies like biopsycho and social therapies can be done. community mental health. Even in the community setup, how we will be taking care of the mental health people. What are the psychiatric emergencies? Adult emergencies are different, whereas psychiatric emergencies and crisis intervention will be there. Forensic psychiatry, and what are the legal aspects, like Indian Lunacy Act will be there. Some different acts will be there for the mental patients. What are the different acts you will be seeing? So the most focused areas are therapeutic nurse-patient relationship, mental disorders. There will be various mental disorders, and what are the major nursing interventions can be given to those patients you need to read. Whereas some therapies will be there, like biopsycho and social therapies, milieu therapies, personal behavior therapy. All these therapies can be dealt. Whereas psychiatric emergencies and crisis intervention, forensic psychiatry. These units carries more marks for your examination. Next subject in the second year is child health nursing. Child health, which is also called as pediatric nursing. So mainly we'll be dealing with the pediatric conditions. What are the normal conditions? What are the abnormal conditions? So what is the growth and development of a child? So in growth and development, you'll be having from infancy to adulthood. What are the growth and development? What are the various changes takes place in the baby? And about the sick child, what are the disorders and health problems of the child? Child with congenital disorders, like by birth itself, they will be having some disorders, and children with various disorders and diseases, and child welfare disorders. So all this will be dealt in the pediatric nursing. So mainly you need to focus on the growth and development. Then you need to focus on the sick child, child with congenital disorders, children with various disorders and diseases, and child welfare diseases. So till now, we have finished with the second year medical surgical nursing 1, 2, mental health nursing, and child health nursing. So in third year, it will be divided as 2 parts, part 1 and part 2. In part 1, you will be having subjects like paper 1 and paper 2. Paper 1, it is about midwifery and gynecological nursing, which is for 140 theory hours, and practical, you'll be going to the hospital for the practical, that is around 560 hours. Paper 2, community health nursing 2. Same in the first year, how you have dealt with the community health nursing. Here also, you'll be having community health nursing 2, where theory hours will be 90 hours, practical hours will be 160. So you'll be having co-curricular activities, which is for 10 hours. Coming to midwifery nursing, here in this, you'll be dealing about normal pregnancy. What are the normal pregnancy changes? What are the physiological changes that happens in the pregnancy? Then you can see normal labor, normal management, how you need to manage the labor, what is the reproductive system, what is embryology, how you, after delivery, how you'll be managing the newborn baby, and what is the normal puerperium. After delivery, when the mother is coming back to normal stage, that is about puerperium. So all will be dealt in the midwifery. It is still unit 7, and you will be having what are the management of complications during pregnancy. So during pregnancy, minor complications or major complications, how you need to deal. High risk labor, what are the complications of puerperium, how to manage it, and high risk and sick newborn, what are the obstetric operations, and what are the drugs used, and what are the ethical and legal aspects which are related to the midwifery. So in this, you will be focusing mainly about the normal pregnancy, like what are the physiological changes that takes place during pregnancy, and in normal labor, what are the stages of labor, and how each stage is managed, and what is the management of newborn. As soon as the newborn is born, how you'll be managing, how you will be taking care. Then management of normal puerperium, management of complications during pregnancy, high risk labor, complication of puerperium, high risk and sick newborn. So these are the chapters where you need to focus in the midwifery. In midwifery, again, you will be having gynecological nursing, mainly gynecological nursing, where it is dealing with the female reproductive parts, where whenever they are having any problems, like what is about puberty, fertility, infertility, what are the pelvic infections, what are the gynecological disorders, breast disorders, and menopause. So in this, all the units are important. Mainly you can focus about the gynecological disorders and breast disorders. So in third year, for midwifery, in this 2, you'll be having midwifery and gynecology. Whereas in community health nursing 2, here you'll be learning about the health system in India, healthcare delivery system. In the first year, all assessments you'll be learning. Whereas in the third year, you'll be learning about what is health planning, what are the health problems, what are the health programs, what is demography, what is the family welfare. All this will be dealt in the third year. And you can even learn about health information system, what are the health agencies or what is a health team where you need in community, how the setup will be. Till now, we have seen about third year, part 1, where only 2 subjects will be there, midwifery and community. In part 2, that will be, you will be writing as examination, as public examination you will be writing. Whereas part 2, you will be having nursing education and introduction to research and statistics. So mainly it will be paper 1 and paper 2, professional trends and adjustment, nursing administration and ward management. So this will not be as a university exam. In college itself, you'll be having 120 hours, that 2 weeks of classes, and exam will be conducted in the college itself. So till now we have seen totally about the theory arts or theory, how it will be done, whereas complete practical arts. So in the first year, only fundamentals of nursing, you'll be going to the clinical areas where you'll be learning how to assess the patient. Whereas medical surgical nursing, you'll be going for 6 weeks. For child health nursing, you'll be going for 2 weeks. For mental health nursing, you'll be going for 2 weeks. That is for second year. And for third year, midwifery and gynecology, you'll be going for 8 weeks. And community also, you'll be going 6 weeks. So you'll be having separate practical hours. So total 24 weeks of practical hours you'll be having for second year and third year. So when we see about the scheme of examination for the first year, so for the first year, paper 1, biosciences. So first you have seen about anatomy and physiology and microbiology, right? So total marks will be 100 marks. So for that, internal assessment, internal exams will be conducted in the college itself for 25 marks, and council or board examination, that will be about 75 marks. So you need to pass even in the internal exam as well as the exam which is conducted by board. So you can see weightage, like for anatomy, it is 65%, and for microbiology, it is about 35%. That means anatomy is carrying more marks, and your examination will be for 3 hours. So anatomy exam, for example, anatomy and physiology will be for 50 marks. So then microbiology will be for 25 marks. So 50 plus 25, 75 marks. So like this paper will be coming in the same question paper itself. Whereas in the second subject is paper 2 is behavioral science, psychology and sociology. Same you can see here, total marks will be 100 and internal assessment will be 25. Then board examination marks will be 75. Weightage will be like same, like psychology will be 50 marks exam. Sociology will be 25 marks exam. So you need to write this exam for 3 hours, and total, when the final result comes, it will be coming as 100 marks, where internal marks as well as external marks like board exam marks will be coming. Then foundations of nursing, that is fundamentals of nursing, 100 marks, same, 25 internal and council 75. For foundations, you will be having practical, I will be telling you. At last, you can see that practicals, fundamentals of nursing, right? So internal exam for practical 50 marks will be there. Even practical exam will be conducted by the board, that will be 50 marks. So in case if you fail in the practical exam, you need to write theory exam as well as practical exam again. Either you fail either any practical or theory exam, any of it, if you fail, you need to attend the exam again. Then community health nursing will be the fourth paper. You can see 4 subjects are involved, and in this community health nursing 1, it will be for 50%. So most of the part will be from the community health nursing 1. Environmental hygiene, it can be asked in the bits for any fill in the blanks or choose the correct answer, 10%. And then health education and communication skills, that is for 25%, and nutrition is for 15%. So based on the weightage of this percentage, you can read the subjects. When it is of less percentage, you can focus on like it can be coming in the bits. Then whereas community health nursing 1, it will be in the form of essay questions and all. So this is the scheme of examination for the first year. Coming to second year, medical surgical nursing 1, medical surgical nursing 2, mental health nursing and child health nursing. Same internal assessment will be 25, and with the council of board, it will be 75, and duration of exam is for 3 hours. For second year, you will be having practical exam for medical surgical nursing. Total marks for practical is 100, and internal marks will be for 50, and council board examination marks will be 50. Same here also, you need to pass both practical exam as well as the theory exam. Then you'll be having practical 2, that is child health nursing. Child health nursing also, practical also you need to pass, and as well as in the theory. Mental health nursing also you will be having practicals, but it is not by the council or board of examination. Mainly mental health nursing practical, when you go to clinicals in the college itself, they will be conducting the examination. It will not be counted in the final exam as a practical. Then scheme of examination for the third year. Third year, you will be having only 2 subjects like midwifery and community. Same, it is for 3 hours. Internal assessment 25 marks and council of board of examination, it is 75 marks. In this, you will be having both exams as practical, midwifery and community health nursing. So till now, we have seen various subjects. What is the course duration? What are the curriculum? What are the subjects involved? And what are the weightage? And how the scheme of examination will be. So I have explained in 1 hour, nursing is not a simple thing which is dealt only. Now 1 hour I have told, so it is completed. But it is going to be worth. So when you develop a passion for learning, if you do, you will never cease to grow. So till now, you have seen about what is the curriculum, which is in the Diploma of General Nursing Midwifery, and you'll be having internship. 2.5 years will be your course, complete course, and an internship will be for 6 months, which you will be having in the parent hospital itself. Suppose if you are in working in Bangalore, any hospital, that hospital itself, if you are studying, that hospital itself, you need to do internship for 6 months. Thank you one and all for your active participation. I hope it will be useful for your future. And nursing is not a simple thing, but it is a noble profession. So as a saying, if you save a life, you are a hero. But if you save 100 lives, you are a nurse. Thank you one and all.
Thank you, Nilima, for your absolute complete explanation.
Thank you, ma'am. Thank you, ma'am, for the opportunity. I
Yeah.
hope this will be helpful for the students who are looking for a general nursing course. Thank you, ma'am.
Yeah, thank you. Hello, viewers. So till now, Mrs. Nilima has explained you about what are all the courses which are present in a GNM curriculum, that is general nursing and midwifery, and what are all the subjects which are distributed in 3 years. Previously, it was 3.5 years, and from 2015 onwards, it is again a 3 years course, and in that 3 years itself, you will be having 6 months internship, and